How do we make sure that everyone gets vaccinated against COVID-19, gets the protection that the vaccines give us? At the same time, some people, you will know, are against vaccines or just a little worried about them. Well, the insurance company Discovery Life says it's offering an incentive to its members who get vaccinated. Riaan van Reenen is the CEO of Discovery Life. He joins us now. Riaan, good afternoon to you. Thank you for your time on Newsfeed. What kind of incentive are you offering people to get vaccinated against COVID-19?
Good afternoon, Stephen. We offer what we call the Vaccination Max Payback Special Offer. Effectively what that does, it allows a new policyholder to accrue in the first year of that policy up to the full premium paid in the first year into a payback fund, which is then paid out in the normal conditions, either at year 5 or year 10 of a policy. So effectively we're treating responsible vaccinated people the same way that we would treat and offer payback benefits to our Diamond Vitality members.
So is this only for people who are new members?
Yes, it only applies to new policies. We've launched this benefit last week on the 29th of July, and all new policies from that date would qualify for this special offer.
Do you think it'll make a difference? Do you think it'll result in more people getting vaccinated? And I mean, it's very interesting, the sort of health incentive space, which your holding company Discovery has been very active in. Do you think this is going to make a difference? Is it going to encourage people to do it?
I think on the margin it will make a difference. We found that we've got a high level of vaccination take-up within our policyholder base through various surveys and reach out to policyholders where we've called Discovery Life policyholders to help them through the registration and the booking process to get vaccinated. We've encountered about an 8% vaccine resistance with another small percentage of hesitancy. So it might just get those people that are still slightly hesitant across the line to get vaccinated. But by and large, we found that most of our policyholders will get vaccinated or choose to get vaccinated, and we want to reward them for taking that responsible step and reducing their risk.
How do they prove that they've been vaccinated? They can't just rock up at your office with a sore arm. I presume they need to have the document, the vaccination card that you get.
We've got a very good integrated data system. On the application form, you would answer the question whether you have been or will choose to get vaccinated when you are eligible or when you have a chance. As all questions on a life insurance policy, it operates on the basis of trust. But through data mechanisms, we will have the ability to check that at a later date. So it's all very seamless at the policy application stage.
There is an argument that other people might bring to you. They might say that you're discriminating against them because of a decision they've made around their bodily integrity not to get a vaccine. I mean, this is quite a complex area in some ways. How would you deal with an argument like that?
It is a complex area indeed. I think first to say we're not forcing anybody to get vaccinated. It's free choice, and we're rewarding people who choose to get vaccinated on the basis of risk. Insurance companies set premiums and policy conditions on the basis of risk, and the risk of dying from COVID is clearly materially different for a vaccinated versus an unvaccinated individual. So it's your free choice not to get vaccinated, but like all choices in life, some choices have really responses to it. So the consequences of your choices, and the consequence of a choice of not getting vaccinated against COVID is an elevated risk of mortality, and hence we charge a fair premium for that risk. I guess the same argument can be made that you shouldn't penalize vaccinated individuals for the higher risk introduced in the total risk pool by unvaccinated individuals. So it's a much fairer approach to charge the accurate price of risks for both sides of the risk pool.
I suppose every time you sign up for life insurance, the first question you get asked is, do you smoke? It's the same question.
It's a very similar approach. So smoking is also a lifestyle choice. Smoking clearly elevates your risk of mortality as well as contracting severe illnesses, and hence you pay a higher premium if you're a smoker compared to a non-smoker. Similarly, it would be unfair to charge a higher rate to everybody given that there are some smokers in a population.
So, as I say, I made the point that your holding company, Discovery, has been using incentives to get people more healthy. In other words, people who go to the gym get better benefits. They get sometimes just a free coffee. They have to prove it on the watch. All sorts of things happen as a result of that. But the health incentive space is a big area of research now. I would imagine that you're starting to see the results of that, that if you incentivize people correctly to live a healthier life, so to give up smoking, to exercise more, to eat better, you start to see the benefit of that, and it actually costs you as an insurance company, as a health group, a lot less money in the longer term.
That's exactly right. We do see the benefits of healthy lifestyle choices. Our products do integrate with Vitality, which rewards and incentivize healthy lifestyle choices. So where you are a Diamond Vitality member, for example, you would benefit from much richer benefits and lower premiums compared to an unengaged individual. So we already do allow for that.
Do you think this is something government should look at? In the US, they're looking at paying people to get vaccinated. There's a sort of carrot and stick approach. I mean, what they're suggesting is, in some places, if you are not vaccinated, you basically have to show a negative test to do anything. That's the idea. If you are vaccinated, you can just walk into the pub or tavern or whatever it is. And then the other sort of carrot approach would be to pay people to get vaccinated. Do you think that's something we should look at, something you've been, some sort of area of research you've been looking at?
There have been multiple examples across the world of both carrot and stick approaches of vaccine lotteries as one example, or payments, or various different incentives, as well as sticks. And it does seem to have an impact. It does seem that the freedom of movement seems to be the biggest incentive for people to get vaccinated. I'm not sure if you've seen yesterday, the city of New York also announced that I think they've used the words, if you want to fully participate in our society, then you will need to be vaccinated. So you either need to show that you're vaccinated or produce a negative test result if you want to go to the gym or want to go to the pub. And I think that's becoming more and more prominent across the world. We also see that people want to travel on holiday and want to visit places. They inquire quite frequently whether the place where they will be visited, staff have been vaccinated, and what their vaccination policies are. So I think there is definitely a movement towards becoming a lot more pro-vaccination, and we've seen the vocal part of the anti-vaxxers in society. It appears that the pro-vaccine side of society realize now that the anti-vaccine part of a society have consequences for society as a whole, and they're starting to speak up as well. So I think it's a fascinating space which we'll watch closely.
I mean, there's a lot to it. There's the science, but there's also there are also rights to it. There's also legal cases that we might start to see. Do you think, I mean, your sense of things at the moment, most of your members are pro-vaccination, getting vaccinated. You're finding people actually getting vaccinated quite quickly. Most of your members, I imagine, are in urban areas.
Yes, that does help. Access to vaccination site clearly helps, and that's one of the burdens that Discovery Life has been solving by setting up mass vaccination sites and really giving access to vaccinations. We've seen more than 30% of the entire Discovery Life book have been vaccinated, and that increases to more than 50% if you go to lives older than 60. So there's a really acceleration of vaccinations in the country, and we believe that will pick up further. It remains everybody's choice at the end of the day. I mean, that's definitely will remain the case.
Riaan van Reenen, CEO at Discovery Life, I do appreciate the time. Thanks very much indeed. It's a fascinating conversation, incentivizing people to get a COVID-19 vaccine. Well,